Hello, doctor.
Hello, good morning, everyone. Yeah.
Good morning. Please give us the context or a background on why diabetes is a growing challenge in India.
All the lifestyle disorders, not only diabetes, are on a rise due to a change in the environmental factors. We are genetically predisposed as Asians. So Indians have always been at high risk of diabetes right from the beginning. Now that our lifestyle is getting worse in terms of healthcare, there is an increment in the lifestyle diseases, and this includes diabetes. COVID has added fuel to fire. COVID has also increased the prevalence of diabetes by the pathology itself in terms of virus directly affecting the pancreas.
What is insulin therapy and what percentage of diabetic patients are dependent on insulin therapy?
Insulin is a hormone which controls sugars. If you're lacking insulin or if you're lacking the effect of that insulin, when you have insulin resistance, well, you get what is called as diabetes. The sugars don't enter the cells, they remain in the bloodstream, and that is how one gets detected with diabetes with high blood sugars. Sugar is a toxin to the body. So if you have high sugars in the blood, you are likely to damage each and every organ.
Absolutely.
So it is important to keep sugars in appropriate range. So how do you keep this is through appropriate insulin action. 30% of our diabetic patients totally lack insulin, or they have an ineffective action of insulin. In such situation, you require to give insulin externally. It will prevent the complications rather, and the patient will be having a good quality of life. All the type 1 diabetics require insulin because they are insulin dependent. So it's 100% of type 1 diabetic. But when you talk of adult diabetes, nearly 30 to 50% of adult diabetes, which are type 2 diabetes, would also require insulin. Beyond that, you have different other types of diabetes like pregnancy diabetes, pancreatic diabetes. They also require insulin. Okay. So you have different types of diabetes requiring insulin.